All right, we are wrapping up chapter 5 talking about bone classification. So we're going to look at how we classify bones according to their shape and then the function of each of those types of bones in the body. All right, so the adult skeleton is made out of 206 bones on average. That can vary a little bit. We won't get into detail about that, but some people can have an extra pair of ribs or one less pair of ribs. Sometimes there's different numbers of vertebrae, stuff like that. So there's some variation, but this is the average. These bones are divided into 5 main categories based on their shape. So the first we've already talked quite a bit about is long bones. These are bones that are longer than they are wide. These function primarily like levers, and so this is mostly what we see in our arms and legs because that's a lot of where movement is going to be happening, and we'll talk more about this lever system when we do our muscle chapter here in a couple of weeks, but that's the function of long bones. Short bones are going to be kind of cube-shaped. Their job is to provide stability and support, and so these are going to be things like the carpal and tarsal bones that we saw in the ankles and wrists, and that's pretty much it. We don't have many other short bones in our body. Next is flat bones. The name is pretty self-explanatory here. These are going to be thin bones. These can serve as points of attachment for muscles, and then they often also protect internal organs here. These aren't perfectly flat. These can be curved. The flat refers more to the fact that they are thin. All right. So bones of the skull are mostly going to be flat bones. The scapula, the sternum, and the ribs are all considered to be flat bones. So you can kind of imagine how those are going to help protect internal organs while also being an attachment point for muscles. Next up are irregular bones. Again, the name is pretty self-explanatory here. These are bones that just don't fit very well into the previous 3 categories. So these are not easily characterized shapes. Their main job is to help protect some internal organs. So things like the vertebrae that protect the spinal cord. A lot of the bones in our face are going to be irregular bones. We'll talk about some of these in our next lab unit. But there's no one general function that is going to perfectly cover every single irregular bone, but most of them do offer some protection to internal organs. And then last but not least are sesamoid bones. These are going to be small and round, so these are sesame seed shaped, and their job is to help protect tendons from compressive forces. So tendon is connective tissue that is going to attach muscle to bone, so it's going to be that anchor between muscle and bone. And compressive forces is going to be a lot of pressure that's generated in a particular joint. And so there's some places where having these special sesamoid bones is really beneficial. And so the main place that we see this is the patella. So that kneecap is going to be a sesamoid bone. It's encased in that patellar tendon that's helping to form that knee joint because there is going to be a lot of pressure coming from movement of that knee joint. All right. So this is where the other place where we see a lot of variation in the number of bones that an individual person has. So the number of sesamoid bones can vary a lot from person to person, so how many they have and where exactly they're found can vary a lot. Again, one of the main ones is that patella in the knee. There's also some in the hands and feet. Those are the ones that are common to all people, but there are other ones that can be found elsewhere in the body in certain people. And so this is just kind of that visual depiction of some of these. So long bones, again, these are primarily making up our arms and legs. Then we've got our flat bones up here, like the sternum, as well as those bones in the cranium, so around the brain. Irregular bones are like the vertebrae. Short bones, again, the tarsals and carpals. And then we've got the sesamoid bones here. We're using the patella as our demonstration. And that wraps up chapter 5, finally.